Hi everyone. In this video, I would like to talk about just a few of the main points from Dusan Kecmanovic's Postpsychiatry, How to Throw Out the Baby with the Bathwater. The article begins with a description of what the term post-psychiatry means. Kecmanovic, and I'm not sure I'm pronouncing that exactly correctly, but I'm going to pick a pronunciation and go with it. If you know how to pronounce that word better than I do, then please let me know. Kecmanovic discusses how the post-psychiatric view criticizes the medical model, positivism, and reductionism in modern psychiatry. Incidentally, positivism is the view that science is the only valid knowledge and facts the only possible objects of knowledge. Specifically, though, post-psychiatry campaigns for the, according to Kecmanovic, post-psychiatry campaigns for the deprofessionalization, de-psychiatricization, and even demedicalization of psychiatry. They want to give the prominent role to service users and carers. According to Kecmanovic, psychiatry is effectively sidelined in the post-psychiatry movement in treating the mentally ill. The author agrees with many of the criticisms of mental health care brought out by the anti-psychiatry and post-psychiatry movements, such as the need to critique the rarely questioned allegiances to the natural sciences and a preoccupation with drugs being the preferred treatment modality, regardless of the mental disorder. But the author takes issue with the major complaints of the post-psychiatry movement. First, against the assertion that it is possible to practice good mental health care without focusing on diagnosis, and instead that a mental health care team should focus on the patient's needs. Kecmanovic replies that a healthcare team's concern for patients' needs doesn't mean that the diagnosis is not important. Diagnosis is one important aspect in treating the whole person, and so should not be set aside. Second, Bracken and Thomas argue that the post-psychiatry perspective sees context first and more important than diagnosis. Kecmanovic's reply is that one cannot know the origin of someone's problems in context if they don't know what the problems are. In other words, one must know the symptoms in order to address the context, which is, of course, the point of diagnosis. The author then addresses the question, what role would psychiatrists play in the diagnostic process in a post-psychiatry world? Bracken and Thomas ask what Kecmanovic thinks is a key question: what right do we have to impose on others explanations for their experiences that may conflict with their understanding? Kecmanovic has three responses to this. First, the views of individual psychiatrists of mental disorder has not been uniform. Second, psychiatrists do not impose on others an explanation for their experience. They let the patient know what they think, and then it is up to the patient to follow through. Third, in a good number of cases, patients do not have their own view of where their mental problems came from. All in all, contra Bracken and Thomas, so against Bracken and Thomas, Kecmanovic thinks that psychiatry cannot do without the medical mind. Otherwise, psychiatrists would run the risk of throwing out the baby with the bathwater, as the saying goes, which is what Kecmanovic thinks post-psychiatrists are trying to do. I hope this video has helped you understand this very interesting article. Thanks for your time and attention.